Have you ever noticed that you feel different when you wake up, even after what seemed like a normal night's sleep? Not unwell, not in pain, just a little heavier, a little slower. Maybe your head feels full, or your body takes longer to settle into the morning than it used to. Most people don't give that feeling much thought. We tend to blame age, a restless night, or just getting older, and move on with the day. But here's something quietly interesting. Many changes in blood circulation don't happen while we're busy, stressed, or rushing around. They happen when we're still, when we're lying down, when we're asleep. This isn't something dramatic. It's not about sudden events or emergencies. It's simply a pattern doctors and researchers have noticed over time. The body behaves differently at night, especially after the age of 60. Blood flow slows, pressure shifts depending on how the body is positioned, and small habits we repeat every night can place gentle, repeated strain on the heart, the brain, and the blood vessels, without us feeling anything obvious at the time. Before we go any further, let me be very clear. This is not a warning. It's an explanation. Nothing here is meant to alarm you. No one is saying that sleep is dangerous or that you're doing something wrong. In fact, most of these habits are completely normal and very common. The purpose of this conversation is simply awareness, to pause, to notice, to understand how the body works a little differently now than it did years ago. If as you listen, you find yourself thinking, "That sounds a bit like me," that's enough for now. There's no urgency, no pressure to change anything yet. Just awareness, calm, steady, and informed. And from there we can talk about what truly matters next. Before we go any further, it's important to slow the pace for a moment and clear something up. Not everyone who sleeps a certain way is at high risk, and no one is going to trigger a stroke just because they slept wrong one night. That kind of thinking creates fear, and fear isn't helpful here. The body doesn't work like a switch that suddenly flips from safe to dangerous. It works gradually, gently, over time. After the age of 60, most bodies simply adapt more slowly than they used to. Blood vessels are a little less elastic. Circulation responds a bit differently to gravity. Recovery during sleep takes a touch more support than it did years ago. That doesn't mean the body is failing, and it certainly doesn't mean it's betraying you. In fact, the body is doing what it has always done, adjusting to the conditions it's given. Many people assume that if a health topic mentions stroke, it must be a warning or a scare tactic. That's not what this conversation is about. This channel isn't here to frighten you. It's here to help you understand how small, everyday habits interact with an aging body, so you can stay calm, informed, and in control. Sleep itself is not the enemy. Rest is still one of the most protective things you can give your brain and heart. What we're exploring are patterns, not blame. Repeated habits that are very common, very human, and often completely unintentional. And the reassuring part is this: patterns can be adjusted gently. Nothing here requires drastic change, strict rules, or medical treatment. If you're listening and thinking, "All right, this feels reasonable," that's exactly where you should be. You don't need to be on edge. You don't need to diagnose yourself. You don't need to fix anything yet. Just stay with the conversation, calm, steady, and curious. From here, understanding becomes much easier. Once we understand what actually changes in the body after 60, a lot of this starts to make sense, and it stops feeling random. First, let's talk about blood. As we age, blood naturally becomes a little thicker at night. Hydration shifts, circulation slows during rest. This isn't a problem on its own. It's a normal nighttime pattern. But it does mean blood responds more strongly to pressure and position than it used to. Next is blood pressure. Blood pressure doesn't stay flat while we sleep. It rises and falls depending on posture. Small changes in head, neck, or chest position can subtly alter how easily blood moves to and from the brain. After 60, those adjustments matter more because the system isn't as elastic as it once was. That brings us to the blood vessels themselves. The vessels in the brain and neck lose some flexibility with age. They're not damaged, just less springy. When pressure is applied for long periods, they don't bounce back as quickly. Now here's the key point most people never hear. When you're asleep, your body doesn't shift positions often. That means a single posture can apply the same mechanical force for 6, 7, even 8 hours straight. Sleep itself isn't the issue. Stillness is. A pillow that bends the neck slightly. A position that compresses a vein. A posture that changes how gravity pulls on blood. None of these are dramatic on their own. But applied night after night, the pressure adds up. This isn't bad luck. It's not weakness. And it's not just aging. It's simple mechanics acting on a body that now responds more slowly. That's why the idea is so important to understand. Sleep doesn't cause problems. Repeated pressure does. Once you see it this way, the mystery disappears. And something else happens too. The fear drops away. Because mechanics can be adjusted, pressure can be reduced, and small changes, applied consistently, can make a meaningful difference. At this point, most people think, all right, that actually makes sense. And that's exactly where clarity begins. At this stage, the goal isn't to shock or correct anyone. It's simply to notice patterns that feel familiar and understand why they matter more after 60. None of these habits are wrong. Many people have slept this way for years. What changes is how the body responds over time. Habit 1. Sleeping flat on your back, head level with the heart. This is a very common position. Many people choose it because it feels neutral, symmetrical, and restful. After 60, though, this position can quietly affect circulation overnight. When the head stays level with the heart for hours, gravity doesn't assist blood returning from the brain. In younger bodies, vessels adapt easily. But with age, blood becomes slightly thicker at night, and vessels lose some elasticity. What the body experiences isn't pain, it's subtle pressure. Blood may linger longer in the upper body. Oxygen delivery can become less efficient. Over time, this may increase strain on delicate vessels in the brain and eyes. This doesn't cause a problem in one night, but repeated night after night, it can add to the overall circulatory load. That's why even a small elevation, just enough to lift the head slightly, can make a difference over time, without changing how comfortable sleep feels. Habit 2. Sleeping on the right side for long periods. Side sleeping is often recommended, and for many people it feels natural. But which side matters more after 60 than most people realize? When you sleep on your right side, body weight can place gentle pressure on a major vein that returns blood to the heart. In younger adults, this isn't usually noticeable, but later in life, circulation already works a little harder at night. Over time, this position may increase strain by slowing venous return slightly. The heart compensates quietly. Blood pressure may fluctuate more than usual. What the body experiences isn't discomfort, it's extra effort. The system works, but less efficiently. That's why many clinicians now suggest left-side sleeping as a calmer option for the heart and circulation, especially for people with blood pressure concerns. Again, this isn't about danger. It's about reducing unnecessary workload where possible. Habit 3, using a very high pillow or stacking multiple pillows. This habit usually comes from good intentions. Comfort, breathing, reflux relief. But after 60, excessive pillow height can quietly affect blood flow to the brain. When the head is pushed too far forward or upward, the neck bends unnaturally. This can place pressure on arteries that travel along the spine and into the brain. What the body experiences overnight is reduced flow efficiency. Not enough to wake you up, not enough to cause pain, but enough to increase strain over time. Many people notice morning neck stiffness, dull headaches, or light dizziness, and never connect it to pillow height. The goal isn't more pillows, it's better alignment. A single pillow that supports the natural curve of the neck often reduces strain far more than stacking height. Habit 4. Sleeping tightly. Curled in a fetal position. This position feels comforting and protective. For many people, it's instinctive. But when the body curls too tightly, knees pulled in, chin tucked, it can quietly affect breathing and circulation overnight. The chest has less room to expand. Breathing becomes shallower. Oxygen delivery can drop slightly, especially during deep sleep. At the same time, prolonged muscle tension around the neck and shoulders may increase pressure on small vessels feeding the brain. What the body experiences isn't stress. It's compression, less movement, less expansion, less flow. Over time, this can increase strain, particularly in people with cardiovascular or respiratory sensitivities. The solution isn't to avoid side sleeping. It's simply to open the posture slightly. Straighter legs, relaxed shoulders, neutral neck. Small adjustments change everything. Habit 5. Going to bed soon after eating or drinking alcohol. This habit is often social, habitual, or relaxing, and very common. After 60, however, eating late or drinking alcohol before sleep can quietly affect circulation during the night. Digestion pulls blood toward the gut. Alcohol widens blood vessels temporarily, then triggers rebound, tightening later. The body experiences shifting pressure. Blood flow moves away from the brain, then fluctuates as the night goes on. This doesn't feel dramatic, but over time it may increase strain on the vascular system, especially during the early morning hours when many circulatory events occur. Spacing dinner earlier and allowing time before sleep gives the system a chance to stabilize, calmly, without restriction. Where this leaves you. If you recognized yourself in one or two of these habits, that's normal. Most people do. The key isn't to change everything. It's to notice where strain can be reduced gently and consistently. Nothing here is about fear. It's about alignment with gravity, circulation, and how the body now works. And once people see that, they usually think, this feels manageable. I can make small changes without turning sleep into a problem. That sense of trust is exactly where real change begins. At this point, the most important thing to remember is this: you don't need to fix your sleep. You just need to reduce strain a little. After 60, progress doesn't come from doing more. It comes from doing slightly better, consistently. Here are a few micro-actions that are simple, inexpensive, and realistic. Things you can try tonight, without turning sleep into a project. First, adjust one pillow, not your whole bed. If you sleep on your back, try a pillow that gently lifts your head just a little, enough to feel supported, not propped up. If you stack pillows, remove one. and notice how your neck feels in the morning. This single change can quietly reduce pressure without affecting comfort. Second, use a body pillow strategically. If you sleep on your side and tend to roll onto your right side or curl up tightly, placing a pillow in front of you or between your knees helps keep the body more open and aligned. It's not about posture perfection. It's about giving your body a softer, more neutral position to rest in. Third, shift dinner slightly earlier. You don't need to change what you eat. Simply finishing your last meal 30 to 60 minutes earlier than usual gives your circulation time to settle before sleep. If alcohol is part of your routine, spacing it further from bedtime reduces overnight fluctuations. Fourth, add one gentle habit, not 5. A short walk after dinner, a glass of water before bed, turning off bright screens a little earlier. Choose one that feels easy enough to repeat. The key idea is this: you don't need perfect sleep. You need less strain. When sleep feels simpler, people stay with the changes, and that's where calm, lasting benefit comes from. If there's one feeling many people carry quietly after 60, it's this: maybe I have already done too much damage. Years of sleeping a certain way, years of habits no one ever explained. That thought can feel heavy, but it isn't accurate. The body does not stop adapting with age. It simply adapts more slowly, and it responds best to clarity, not force. Your brain, in particular, is remarkably sensitive to small improvements. A little less pressure, a little better blood flow, a slightly calmer night. These aren't insignificant changes, they're exactly the kind the nervous system recognizes and builds on. This is why nothing here is about undoing the past. The body isn't keeping score, it's responding to what you do now. Even modest adjustments in sleep position, breathing, or timing can shift how the brain and blood vessels experience the night. Not all at once, not dramatically, but enough to matter, especially when repeated. And that's the quiet relief many people feel when they understand this. You didn't fail your body. You were never taught how subtle these mechanics are. After 60, improvement doesn't come from force. It comes from alignment. When the body feels supported instead of pressured, it does what it has always done best. It adjusts. You're not late. You're still very much in the conversation. This channel exists for a very simple reason: not to scare you, not to push quick fixes, and not to tell you what you've done wrong. We talk about health the way the body actually experiences it: calmly, preventively, and sustainably. After 60, the goal is not optimization, it's clarity, understanding how small, repeated choices shape how you feel. Without pressure, guilt, or extremes, every conversation here is built on respect for where you are now, your pace, your history, your independence. If something here helped you understand your body a little better, if it made you feel calmer instead of anxious, or more capable instead of overwhelmed, that's enough. There's no urgency to act, no checklist to chase, just steady, practical insight you can return to when you're ready. If this way of talking about health feels right to you, stay with us. This is a channel you can grow older with, not outgrow.